Okay.
Start.
Is my screen visible to everyone?
Yes, it is visible.
Okay, thank
You
you.
can. Nilofer, you can start.
Okay, I'm waiting, ma'am. The live is
What?
started. Yeah, okay.
Already started. Start.
Okay. Okay, a warm welcome and good evening to you all. I'm delighted to have you all here today for today's session, today's webinar on childhood disorders, a topic very close to my heart. I'm Nilofer, counselor at Sudisha, and I'm truly passionate about child mental well-being. And I'm committed to building more inclusive and supportive environment for children. So I want to introduce my friend and co-presenter for today's session, Ms. Nitya, counselor, special educator, and most importantly, a loving mother of a special child. She not only brings professional knowledge, but also powerful personal insights that I'm sure will touch and inspire us all today for today's session. So this is today's webinar, and yesterday we had a powerful webinar on PPD, that is postpartum depression and premenstrual syndrome. It was a very informative session. Hope you attended yesterday. So today, together, me and Nitya, we welcome you all to the webinar on childhood disorders. So this initiative of webinar series titled Psychological Disorders, Triggers to Treatment is an heartfelt effort by Team Manojagrithi. Team Manojagrithi is a non-profit organization founded with a vision to spread mental health awareness and to work towards the prevention of mental health issues in the society. With this noble motive on mind and a deep sense of giving back to the society we belong to, Dr. Geetha Challa, a child and adolescence psychologist and founder of Manojagrithi, has envisioned this free webinar series to bring clarity, compassion, and actionable understanding around psychological disorders. So we will start today's session with a conscious breathing technique. Over to you, Nitya, for the breathing technique.
Hello, everyone. To help us all feel centered, calm, and present, let's begin today's session with a simple yet powerful activity, a conscious breathing exercise, followed by the box breathing technique. Taking just a moment to breathe deeply can help us clear our minds and connect more fully with the content we are about to explore. So, wherever you are, take a comfortable seat, relax yourself, your shoulders, and gently follow along as we guide you into a space of calmness. Relax yourself, sit in a comfortable place, sit comfortably, back, neck, and head straight. Remove spectacles and other tight accessories. Keep your hands on the knees. Close your eyes. Slowly inhale and exhale. Normal breathing for 3 rounds. Inhale, exhale. Exhale. Now conscious breathing. Inhale. Thoughts come. Let them come. Don't bother. Come back and focus on your breath. Slowly breathe in. Breathe out. Shoulders relaxed. Body relaxed. Don't resist your thoughts, but don't give more importance to your thoughts. Inhale. Exhale. Inhale. Exhale. One more last time. Inhale. Exhale. Now we will do box breathing. Imagine a box. When inhaling, for the count of 4, breathe in, pause, hold your breath, then exhale for count of 4, then hold. We'll do it for 5 rounds. Closed, straight, shoulders relaxed, body
Hello, ma'am.
relaxed. Inhale. 1, 2, 3, 4. Hold.
Completed, ma'am. In the last, you can talk now.
1, 2,
Yeah,
3,
okay. Thank you.
4. Exhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Inhale. 1, 2, 3, 4. Hold. Exhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Last round. Inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Keep your eyes closed. Now Nilofer will follow with the grounding technique. Keep your eyes closed. Nilofer.
Thank you, Nitya. That was soothing and relaxing. Now we'll take a little step further with a quick grounding technique called 5-4-3-2-1 method. We often are so caught up in our thoughts and we are so much into our heads, analyzing and problem solving, which can cause a lot of stress and disrupt in our mental well-being. This method is often used to reduce anxiety, refocus attention, and gently bring us back into the present moment. It is simple yet powerful, something you can turn to any time you feel like to get connected to here and now. We all are connected to the environment around us with 5 senses. So in this technique, we'll focus on each of them to become more aware and grounded. I request you all to keep your eyes closed, sit straight, spine and neck in the same line. Make sure that your feet touch the ground. Relax your neck and shoulders. Relax your jaw. Gently observe your breath. Inhale slowly through your nose and exhale fully through your nose. Inhale, exhale. One more time. Inhale, exhale. Be the observer of your own breath. Thoughts may come and go, just like the waves in the ocean. Do not focus on them. Just keep your focus on your breath. Now let's tap on our sense of hearing. Try to observe 5 different sounds around you. Do not judge them. Just observe the sounds around you. It might be the gentle music playing. It can be my guiding voice to you or hum of a fan. Do not label it. Just listen and let it go. Now let's tap into the sense of touch, the sense we experience through our skin. Using your right hand or your dominant hand, gently explore 4 different textures around you. The skin of your palm, the fabric of your dress or the shirt, or the armrest of your chair, anything that is in your reach. Just feel the texture. Continue to keep your eyes closed. Let's tap into our sense of smell. Identify 3 different smells around you. It can be the smell of your palm, the fragrance of the room, or food kept nearby. Do not judge the smell. Just observe with curiosity. Now rub your palms together. Make them nice and warm and put them on your eyes. When you're ready, gently open your eyes. Now, with our open eyes, mindfully engage in sense of sight. Look around and notice 2 things in your space. Observe the shape, the color, and the texture, as if you're seeing it for the first time. Just observe. Do not be judgmental. Now let's tap in to the sense of taste. Take the glass of water in your hand. Look at the water as though you're looking at it for the first time. Consider the journey of water from the source through the pipes into your glass and appreciate its availability. As you carefully observe, sip in the water, paying attention to the texture, taste, while acknowledging the water's importance and connection to life. Appreciate the fact that it quenches your thirst and keeps you nourished and hydrated. Take a few more sips and allow yourself to release all the tensions, all the stress out of you. So we connected with our 5 senses. I hope it calmed you down. So let's carry this calm and presence as we now begin our session. So before we begin our session, I have a few quick reminders. So before we begin, I humbly invite each of you to be an empty cup today. Let's set aside our preconceptions, our judgments, and let's be open and fully engaged and fully get engaged in today's session and see what the session has to offer. And I kindly request you to keep your microphones muted throughout the session. If you have any questions, feel free to write them down and we'll be happy to address them during the session in a dedicated Q&A segment. So let's move further now. So today's discussion is all about children. So children are the hope for the future. Don't you all agree? So children, the little people around us, they are our present responsibility and tomorrow's promise. Children are not only hope for tomorrow, they're the heartbeat for today. Nation is not built on infrastructure alone. It is built on the quiet resilience of a child who learns to rise again, on the confidence of a child who feels seen, and the courage of a child who dares to be different and accepted anyway. When we nurture child's mental well being, we are not merely helping them cope, but we are helping them bloom. So we are laying the foundation for a generation that will not only survive, but thrive. A generation that will grow into leaders, healers, thinkers, and change makers, shaping a brighter and more compassionate world for us all to live. So, we have a very good news for you to start with. So, the good news is that every child can succeed. They just take a different path. So, some children, they just take a different path. So, let's prove it with a quick challenge. Here, I'm going to show you 4 different personalities, and I want you to guess them. So, can someone guess the personality on the screen? You can type in your chat box. Is someone typing in? I'm not able to see any chat messages.
Yes, it's Einstein. It's correct.
Okay. Yeah, you're right. So it's Albert Einstein. So he was diagnosed. Uh, he was considered a slow learner, and he had struggle with language. So can someone guess the second personality? Is Steven Spielberg, American filmmaker, and he struggled with reading and spelling. So he had dyslexia. And the third personality you can guess? Elon Musk, right? He's grown up with autistic syndrome called Asperger's syndrome, and this famous personality we all know, Abhishek Bachchan, Indian actor, right? So even he was diagnosed with dyslexia at age of 9. So the child with disorders can also succeed. They just need the extra support and care, and they need a different approach. Their journey can still be beautiful and full of achievements. With that, we will get into our session. Over to you, Nitya.
Yeah, today we are going to see about some childhood disorders. The list of the common disorders are here. First, we will see the childhood depression. Slide. Change. Depression in children and adolescents is a serious mental health condition characterized by persistent sadness, loss of interest, and loss of interest in activities and other symptoms that can significantly impact their daily lives. Mood changes, loss of interest or pleasure, changes in sleep and appetite, low energy and fatigue, difficulty concentrating, and social withdrawal. These are the symptoms. And these symptoms, if they continue for more than 2 weeks, it's better to go for any therapy or next, anxiety. Next disorder is anxiety in children. In children, anxiety is a common issue that can manifest in various ways, including excessive worry and physical symptoms and behavioral changes. Excessive worry and physical symptoms. The physical symptoms include stomach aches, headache, sleep disturbance, fatigue, and muscle tension. And some behavioral changes like irritability, avoidance of situations that trigger anxiety. And the different types of anxiety are generalized anxiety disorder. It is characterized by persistent, excessive, and unrealistic worries about various situations, not tried, not tied to a specific object or event. Social anxiety disorder. This involves intense fear and anxiety in social situations, often stemming from a fear of negative judgment or scrutiny. Separation anxiety disorder. This is marked by excessive distress when separated from primary caregivers. And specific phobias. This is intense fear of specific objects or situations like animals, heights, or water bodies, etc. And fear and phobia are common in children in childhood, but a phobia in an intense and persistent fear of a specific object or situation that significantly interferes with daily life, while some childhood fears are normal and temporary. Phobias require professional help to manage. And panic disorder, marked by unexpected and repeated panic attacks characterized by intense physical symptoms like racing heart, dizziness, and short of breath. Next, we will see about separation anxiety disorder. This is a mental health condition where children experience excessive worry and fear when separated from their primary caregivers. It's a normal part of development for babies and young children. But separation anxiety disorder is diagnosed when this anxiety becomes severe and interferes with daily life. Some of the symptoms persist for 4 weeks or more in children and adolescents. The symptoms are children with separation anxiety disorder may exhibit excessive worry about their caregivers, safety, fear of being lost or kidnapped, reluctant to go to school or sleepovers, physical complaints like stomachaches or headaches, and difficulty in sleeping alone. They may also cling to their parents, cry excessively, and have nightmares related to separation. And the causes are combination of persistent worry, reluctant to go out, and these are the symptoms: excessive distress, persistent worry, reluctant to go out, refusal to be alone, sleep disturbances, and physical symptoms like headaches or stomach aches. And duration of the symptom, it may last for 4 weeks in children and 6 months in adults. Impairment in life functions, significant impairment in academic and occupational functions. Change.
Okay, so now let's talk about oppositional defiant disorder. So to make it simple, the children with ODD, that is oppositional defiant disorder, they do the opposite of what they are asked to do. So they actually want to assert the control. The parents suffer in silence because they're afraid, and they're like little hesitant, and they are little afraid to check how the children will grow up to be. So children with this order have impulse control behavioral problems, and that starts in the childhood itself, so as early as 4 to 5 years. So oppositional is described as a tendency where the child resists to the authority figure, or they show an active physical or verbal refusal to do the command or to follow the command of the authority. So even if it is at home or is it at school. So usually it starts at age of 4 to 5, and it is rare in the adolescence age. It starts little early. So some grow out of this disorder as they reach to the adolescence age, but some need some children will need therapy to come out of it. If it is persistent, if it is continuing, then it may reach to their 20s also. So children with ODD may frequently show anger and aggression, and they often expressing emotional outbursts, and intentionally they annoy people, blaming others, and they will not accept their mistakes. So this behavior is association with deeper emotional and psychological concern, and may be linked with the conditions like ADHD, which we'll be seeing in our further in our next slides. So now ODD is not an occasional behavior. If the child is behaving like so, for example, for 1 or 2 times, then that doesn't come under this order. In this order, the behavior is persistent. Like every command the parent gives to the child is shows resistance to the command, and it happens several times in a week or a month. Then they come under this disorder, and they need evaluation. And if it is happening for more than 6 months, then they need to be evaluated and taken care of. So now let's move to the next disorder, which is linked to ODD, which is conduct disorder. Now, what is conduct disorder? So when the oppositional defined disorder, which we just spoke about, is not treated on time, I said it starts as early as 4 to 5 years. So if it is not treated then it will change into a conduct disorder. And in this, the child is aggressive, shows aggressive behavior. It is a repetitive aggressive behavior from the child, and the child violates the rights of other people, like fighting, bullying, being cruel to people and animals, lying, stealing, and destroying things. And in such cases, the children will not understand the consequences of their actions. So they cannot analyze the feedback given to them, or when they are corrected, they cannot analyze it, they cannot take it in. So these children can also show learning disabilities. So when it is diagnosed and early intervention is given, so to work on their anger management, and if needed some medication is given, then this can be well taken care of. And if it is not taken care, if the conduct disorder is not taken care on time, then there is a chance that it may turn into an antisocial personality disorder. So we have to be very careful and look for these signs and symptoms. So I have briefly listed here the distinction between the conduct disorder and the oppositional defined disorder. So the conduct disorder is more severe because it is in the adolescents children greater than 10 years old, and the aggression is also very intense. There's a lot of lying, stealing, and violation of rights. So this needs to be understood uh, by the parents and taken care before it gets converted into other disorders. So the next disorder that we are going to discuss is intellectual disability. Now, intellectual disability is a developmental disorder. So earlier, this was called as mental retardation as per DSM-4, but now in DSM-5, we call it intellectual disability. So this is purely a developmental disorder, and it is identified significantly below average intellectual functioning of the child. So here the IQ level is very, very low. So according to DSM-5, it is typically evident in the early childhood ages, as early as 4 to 5 months. So, as early as 4 to 5 months after birth, the child will not be able to achieve the milestones that they are set to achieve, and like walking, speaking. So, there are a lot of delays for this such children with this disorder. So, they face challenge in their daily activities like dressing, feeding, using the toilet independently. Social interaction becomes a challenge. Communication becomes a challenge. So their academic performance will also be low because the IQ level is also low. So early intervention is the key again. So when we understand these symptoms and we intervene and we get them assessed, and the outcomes are actually tremendous in children. In such children, we can give them a lot of support, special educational support. We can give them with help of special educators, and this can be taken care of. So now let's move to the next disorder. Over to you, Nitya.
Yeah. Swati, can you read what is written in this slide? Are you able to read it?
I can get only the starting letter A, and there is one number 23. That's it. The rest of the things I'm really unable to.
Yeah. This is the thing. This is the scene a child with learning disability faces. For him, learning is like this. So next disorder we are going to see is specific learning disorders. And specific learning disorder is a neurodevelopmental disorder characterized by persistent difficulty in learning and using academic skills, specifically reading, writing, or maths. Learning disabilities in children are neurological conditions that affect how the brain processes information, impacting a child's ability to learn in specific areas like reading, writing, or maths. These disabilities are not related to a child's intelligence. Early identification and intervention are crucial for helping children with learning disability reach their full potential. They have a problem with reading and writing and with maths. Types of disability is, first type is dyslexia. When the child has a difficulty with reading, accuracy, fluency, and spellings. They don't get the spellings right. With cake, they may write instead of C, their sound will be K. Cake. So they have a problem. So next is dysgraphia. Problem with handwriting, including forming letters, writing within lines, and expressing thoughts in writing. They have a reversal problem in this. For B, they may write D, and S also will be it is like a mirror image, they write it. And dyscalculia is difficulty with maths concepts, calculations, and number sense. So the signs and symptoms of these are difficulty mastering basic academic skills. They don't have the basic academic skills. If early intervention is not given, they will have a difficulty. Frustration or avoidance during learning activities. Trouble following instructions or remembering informations. They have a poor handwriting. And they struggle with attention and focus. And they have problem with language and comprehension and expression. Their expressive language is very low. They don't know how to express whether happiness or sad or any pain. They don't know how to express themselves. So these are the problems these children face, and the causes are generally genetic and environmental factors. Nilofer, next slide. Yeah, they have a persistent difficulty, like ongoing challenges in reading, writing, or maths, and their academic skills are below average. And onset is when after the school going age, they are diagnosed, and then they are not. We can't explain the reason for that. Okay. Next slide. And the next disorder is attention deficit hyperactivity disorder. This is called ADHD. This is a neurodevelopmental disorder that affects a child's ability to focus, control impulses, and regulate activity levels. It is characterized by persistent patterns of inattention, hyperactivity, and impulsivity, often impacting a child's daily life and development. While some symptoms can be typical of childhood, but ADHD symptoms are more frequent and severe, causing significant problem at school, home, or with friends. These children, they have low sitting tolerance and low eye contact, so they keep on moving around. What are the key characteristics of these children? Inattention, difficulty focusing on any one thing. Their sitting tolerance will not be more than 1 minute to 2 minutes. Hyperactivity, they will be very restless, moving around. Impulsivity, acting without thinking, interrupting others. We think they are disturbing others and they are doing without any thinking, but that is their difficulty. And onset is commonly appear before the age of 12, though the signs may be noticed as early as preschool years, 3 to 6 years. Symptoms mostly shown up in school days. Once a child starts going to school, then we notice the difference in the child. Next disorder we are going to see is autism spectrum disorder, ASD. Autism spectrum disorder in children is a developmental disability that affects communication and behavior. It's characterized by difficulties in social interaction and communication. Generally, autistic children don't communicate and they don't socialize very easily. And repetitive behaviors. They have a repetitive behaviors, and when we talk something, they repeat the same. Instead of answering, they repeat the same. Signs of autism typically emerge by age 2 or 3, though some children may show signs earlier or later. The key characteristics of autistic children, like social communication and interaction. They don't have social communication, they don't mingle, the socializing is very low, and poor eye contact. And they may not respond to their name when called. They won't smile back or not point to things they find interesting. They have restricted repetitive behaviors, and their interest and activities are also very low. They show interest in only very specific activities, like playing with their own toys or doing the same activity repetitive. They have a toy and they always want that toy. They don't like change. Repetitive movements like hand flapping, rocking, and spinning. These are some of the behavior we see in autistic children. And strong focused interest in specific topics or objects. Some children, they show a very strong interest in music. Some children show in art or vehicles. They have a very strong interest in that. And the difficulty with transitions and changes in routine. They follow a routine. If one routine is changed, it takes time for them to adjust to that routine. May engage in repetitive play such as lining up toys or blocks. They will put all the things in a line. That will be the play. Their play is in a repetitive way. And sensory issues also they have, like unusual reactions to sensory input like sound, light, texture, or smell. Generally, they have sensitivity in the fingers, so they don't touch any sticky or any mud or sand, and they are very sensitive to sound. They don't like loud sounds. You could have noticed some children, they hear any noise, they cover up their ears. They don't like noise or anybody speaking loudly. So these are the sensory sensitivities the autistic children have. And early signs we can find out by limited eye contact. They have very limited eye contact. Next. Nilofer.
Yeah. So the next we will talk about selective mutism. This is similar to social anxiety disorder that we just discussed. So children here are selectively mute. So they are actually normal and vocal at their home and in their comfort zones, but they are mute when they are questioned outside their comfort zones. These children are not choosing to be silent, but they are truly are unable to speak out of anxiety that they have, so they are not able to speak. So, generally, when in fear, our body will get into fight and flight mode. We all know this. So, but in this case, the children go into a freeze mode or a frozen mode. But they cannot talk back to the person who is asking them some questions. They go mute actually. So, if this is happening for more than 6 months, then it needs to be evaluated. And if it's starting, if the treatment or if the therapies are starting as early as 3 to 5 years, then it can be easily resolved. And the child can gradually come out of the fears and build confidence and speak in all the settings of his life. So these are the few criteria, DSM-5 criteria that I've listed here. So selective mutism is very much treatable with an early intervention and help. So now let's move to next disorder, that is pica. So now what is pica? Pica is a eating disorder, okay, where the child eats non food items or non edible items which have no nutritional value at all. So we must have seen children eating chalk, paper, soap, all those things which are non edible actually. So these children crave and they regularly eat these substances. Now, why this happens? Uh, because it may happen due to a nutritional deficiency. So it is important to consult a doctor first and check for any vitamin or mineral deficiencies. Then, if it is not the reason, then the child can be taken for evaluation and should we explore the underlying psychological or developmental cause for these actions. So because this is very dangerous and it can lead to choking or stomach and intestinal problems or poisoning. So this disorder is actually must be taken seriously by the parents, and they need to act wisely according to the situation. So this needs to be evaluated for any vitamin deficiency first, and if there is no vitamin deficiency, then a psychologist or a psychiatrist needs to be consulted for the same. The next disorder that we are going to look into is elimination disorder. So, elimination disorder is of two. One is enuresis and encopresis. Now, in enuresis, the urinating of the child urinates where they should not be doing it, in inappropriate places. And encopresis is repeated passage of feces in inappropriate places. So the bedwetting habit usually gets resolved by the age of 5 once the child is toilet trained. After that, the child is well settled with it. But if it happens in multiple situations, then it needs to be evaluated. So in case of enuresis, it is 5 to 10% of the children get affected who are 5+ year old, like they are beyond 5 years of age. And in encopresis, it affects 1% beyond 5 years of age. So the child, firstly, should be old enough to get them toilet trained, if the child is trained earlier than their age, then it can lead to this kind of disorders. So it can have this disorder to be considered as a problem. The child should be passing should have this problem, that is passing of urine in inappropriate places at least twice in a week, and it should happen at least for 3 months. And in case of encopresis, it should happen once in a month continuously for 3 months. So one thing which should always be kept in mind is that when certain actions are causing in the daily functions to affect, then it should be considered as a disorder. Okay, so now let's move to the causes and risk factors of psychological disorders. Nitya, please explain us this.
Yeah. So far, we saw all the childhood disorders, but there are we have to see the causes and risk factors of the childhood psychological disorders. First, cause may be biological, that is genetical, or any family history. And second one is psychological and emotional factors. And then environmental and social factors. And sometimes because of complications during birth, and trauma or environmental factors, and some school related stresses. Sometimes in school the child may not be happy or any bullying, then also it causes anxiety to the child. And socio-economic and cultural factors, and nutritional deficiencies. And nowadays, after the corona, most of the disorders are due to the screen time, because children are exposed to more screen time. Lot of this ADHD and autistic are there, but they are not autistic. They are virtual autism. They are virtual autistic, and this can be cured if the screen time is reduced and they go to a school and they get proper guidance. This can be avoided. So these are the cause and risk factors.
Okay, so next we will understand when to consult. So whatsoever may be the causes, we cannot control, but we need to know the red flags of certain of the disorders or of the symptoms, so that we take timely, we seek help. So these are the red flags that we have listed for you on the screen. If you wish, you may take a screenshot or shot of it. We have kept it elaborated so that you can refer to it later. So when there is cognitive attention issues or emotional issues, or there may be repetitive behaviors, as we were talking about them in the earlier slides also, and developmental delays or social interaction difficulties. So all these are red flags that you should be observed, that we should be observing in our children. And an early intervention is always the key, and where we can get them resolved as early as possible, so that the child can have a smooth smooth going forward. So these are the red flags that we need to be look into. Over to you, Nitya, for whom to consult.
Yeah,
Okay.
now we saw what are the symptoms, causes, and everything. After we have found out, we have to know whom to consult for the childhood psychological disorders. A child psychiatrist, we can go for a screening or assessing. They may assess the child and say the level of the child. And psychologist, a child psychiatrist can give any medicine for the child for hyperactivity or any other disorder. And next is the child psychologist. A trained professional in child and adolescent psychology can give any therapeutic interventions like cognitive behavior therapy and any other therapies. And clinical psychologists also can help the child with CBT and other interventions. And other specialists are occupational therapy. Occupational therapy works well with ADHD, autistic children for their sensitivities, and behavior therapy for correcting certain behaviors in the child, sitting tolerance and all, and speech therapy if the child has any speech issues, and special educators can help the child with the remedial. If the child has any learning disabilities, the speech therapy can help, and therapists or counselors are there to help the child. And now we will see the treatment for childhood disorders. So treatment typically involves a combination of psychotherapy, medication, and family support tailored to the individual needs of the each child. Talk therapy. This helps children understand and manage their thoughts, emotions, and behavior. We have to speak with the child. What is the thought? What is the feeling the child has? The child has to express the feelings. Next is a play therapy. Ideal for younger children to express emotions through play in a non-threatening environment. The environment which the child grows should be safe and comfortable for the child. Next is the cognitive behavioral therapy. This focuses on identifying and changing negative thought patterns and behaviors. Next is the acceptance and commitment therapy, that is ACT. This encourages acceptance of emotions and builds coping strategies. So the child should feel comfortable that the parents or the teachers or the caregivers are accepting the child, and it will learn to cope with the issues. Parental training. This is very important. When we are giving therapy to the child, the parents also should cooperate so that the therapist will coach the parents also to do the therapies at home for more progress. And behavior therapy, applied behavior analysis, ABA, uses enforcement to encourage positive behavior, especially in autism. This works better in autistic children. And behavior modification techniques includes token systems, rewards, and structured consequences to shape behavior. When the child is doing a good behavior, we have to reward the child. And if the child is having any negative behavior, we should not discourage, but we can avoid. So when we avoid, the child understands this is not acceptable. So positive behavior should be rewarded. Next is the occupation therapy. This enhances daily life skills, motor coordination, and independence. Occupation therapy is good for children so that they learn the sensitivity and everything comes down. Include sensory integration therapy for children with sensory processing difficulties. Supports attention, executive function, and emotional regulation. Next is the medication, used when necessary alongside therapy to treat conditions like depression, ADHD, or anxiety. The common medications is for antidepressants, stimulants, and mood stabilizers. Monitoring is essential to manage side effects and adjust dosages. Family counseling and support. For any of these disabilities, the family should support the child and improve the child's communication. Family counseling, this improves communication and relationship within the family unit. Parent training programs equip parents with skills to manage behavior and support emotional well-being. So parent training program should be there to bring awareness to the parents and how to manage the child in certain situations. So support groups. Support groups is a must. They provide emotional support and share experiences for caregivers. Educational and school-based support. Special education plans, IEPs. In schools, there should be a IEP plan for each child. For the child's need, every child's need, we should have an IEP, individual education plan, so that we can work on that. School counseling and behavioral interventions. Support emotional and social development. Collaboration with teachers promotes consistency between home and school. So there should be a collaboration with teachers and parents so that there will be a consistency in the child's development. And if the child needs speech, they have to go to a speech and language therapy and social skills training.
Okay, so now let's talk about the importance of nutrition in a child's growth. So we all know that nutrition is the most important part. So what goes into the child's body? So that directly impacts the mind and the behavior of the child. So it's very important that we give the child only the best parts of we should be very clear with what should be included and what should be avoided. So we all know that there should be a balanced diet. So we have listed here a few of the things, like you can take a screenshot of it. So how few things will regulate the mood of the child, like the balanced protein like eggs, lentils and fish, which has good amount of protein, will actually make the child to focus and better focus, and it will also regulate the mood. Like the omega 3 fats, which will help and support the brain development, and like the colorful fruits and vegetables which have antioxidants that will reduce the inflammation. And we have probiotics and like yogurt and bananas, so which can actually help with the healthy gut. So when we have a healthy gut, the brain is also healthy because they both are connected. So the hydration is also very important. So we have to see that the child is hydrated, and we avoid giving them juices. Instead of juices, we can give them wholesome fruits. And what to reduce or avoid, we have to be very clear that there are no artificial additives or which has a lot of colors, sweeteners in the child's diet, because excess sugar can lead to excess energy, which will again have lot of mood swings, and they will not be able to focus. So we should be very careful while we are actually, most of parents, we tend to give them a lot of sodas at a very young age, and lots of chocolates which have a lot of sugar, and fast food, chips, and all this junk we should avoid, so that the child has a healthy body. When we give them good food, when we give them food rich in most of the vitamins and rich in nutrients, they actually they have a healthy development. So, with that, we come to the end. We are open for any questions. If you have, you can type it in the chat box. Good evening, Geetha ma'am.
Good evening. Good evening. Yeah, we can have questions. I know childhood disorders is really important and also very interesting area because they are the future of nation. So let us look at their strengths than weakness. So we are open for questions. You can chat, type in the chat box, or you can ask, unmute yourself and ask. And help me, Nilafar, to read the questions. One of you,
Yes.
Nitya, Nilafar. I think there is a question in the chat box.
Yes, ma'am. How can you make the teen make eat healthy food, as they prefer junk over healthy and often argue with parents?
Kids, how to make it?
How to make them eat healthy food, as they prefer junk over healthy and often argue with parents?
Right. So here, maybe this is out of my experience tip, but there are nutrition and food habits of children is very tough subject to discuss because every child is unique in their food habits. But still, the healthy food you prepare should mimic the junk. That's what is my tip. It should mimic the junk. So, like pizza, let us take pizza. So, kids like pizza, eating pizza. So, there was one of my counselor who used to prepare pizza with the normal chapati at home. Whole wheat ka chapati with vegetables. She used to make pizza at home and she used to give. So that's how we can, make healthy food mimicking the junk food. That's one idea.
Okay, there's one more.
Yeah. Yes, yes. Keep reading the questions.
Uh, come. No, there's no question actually. How can poor family children manage nutritional foods? How can we plan?
Can you read out the question again?
How can poor family children manage nutritional food? How can we plan?
Uh, so there is no rich or poor because nutritious foods are not rich foods. Generally, the nutrition is everywhere. It's not that if you have money, you have a rich food. It's more about selection of food than the money. So you can always have a rich food, nutritious food in a given budget.
How to control the hyperactive active mood of child?
Very good. So at Sudisha Counseling Center, we have been doing this, helping a child to calm down. So I personally, along with my counselors, we use mindfulness, relaxation, yoga postures, brain gym, and there are few activities for impulse control. So all this mixture all together actually are giving very good results. And sometimes you need to have a very good sort of, if they are very young, we cannot, but if they are little grown up, talk therapy will also help. This is my experience. And at home also, actually, it's not about therapy for 45 minutes at home. In the therapy room, 45 minutes, but the parent should be allowed to watch what is going on inside the therapy room and continue in the at home because um, there is a nowadays there is a trend of open therapy rooms where it is not hided. They do not hide anything from the parents. They do the therapy in front of the parents so that they watch and continue when they go home. So all 45 minutes definitely make a difference, but 24 hours the kid is with you. So if you can adopt a small activities, that will calm down the child. Music therapy will help. Art therapy will help for the children to calm down.
Satya has raised the
Yeah.
hand. You can unmute yourself and ask the question.
Yes,
Yes.
madam, good evening. Actually, I was dealing a class, and in that class there was a child, madam. So,
Mm-hmm. Yeah.
like no to me, but in no time, maybe multiple times on different occasions, I had counseled her. Like no, I was calling her, I was talking to her personally. No, I was.
Your voice is not clear. You can type the question in the chat box. That should help us. Nilofer, I think we can take the question in the chat box. It's a little
Yes,
tough
ma'am.
to understand.
Like
Yeah.
no, talk about her good qualities, like no, praising her behavioral.
There is one more question in the chat.
How to
How to
deal
deal-
with an adolescent?
Mhm.
Okay, how to
Yeah.
deal with an adolescent child if he is having ODD, opposite deviant
Opposite.
disorder?
Yes,
Definitely.
yes.
Yes.
Yeah. So when you have a child with the ODD, I look at that in the ABC model. ABC model talks about A is antecedent, B is behavior, C is consequence. So let us not look at the behavior, let us look at the antecedent or reason for his behavior, number one. So if it is the root cause, find out the root cause for his behavioral issue. So if you can work on that root cause, I think it should help the child. So see, there could be sometimes actually hereditary issues are also there. So if it is so, then sometimes medication may be used.
Thank you for answering the questions, ma'am. I think we come to end of the Q&A segment. If there are any questions, you can post.
Yeah. Yeah, we can always take the questions in the group also. We'll be more than happy to answer your questions. Or
Yeah.
you can always type in the chat box. And our Nitya Nilofer is there to, coordinate the questions with me and give you answers.
Ma'am, there's one more question. Is ADHD and OCD are reversible?
See, there are conditions. There is nothing like, cure for these things. They are conditions. You can manage them and you can keep them in control. Both of them. Never
Okay.
look at the cure for all these things. Never look at the cure for all these disorders. It is more of management than the cure. Okay?
Thank you so much, ma'am, for your time, for answering the questions. If there are any
Thank you.
more questions, you can post it in the group and we will
Yes.
definitely come back to you. So let's move further.
Yeah. So all the way, congratulations, Nilofer and Nitya. It was a well done session and very interesting and important session for the society. And you have done your good job.
Thank you
Thank
so
you so
much,
much,
ma'am.
both of you. I'm very, very happy and proud to see my students doing a webinar. Thank you.
Thank you so
Bye-bye.
much, ma'am. Thank you, ma'am. So we come to the end of the session. So Nitya, would you like to take it over?
Yeah. I like to thank Dr. Geetha Challa ma'am for the support and encouragement she has given us in doing our work and how to do our best. And Vijay Lakshmi ma'am also for encouraging us in every step and supporting us in all the situations. So I thank both of them, and Dr. Geetha Challa ma'am and Vijay Lakshmi ma'am, for the full support they are giving us for our improvement. Thank you, ma'am.
Thank you so much, ma'am. Uh, uh, Geetha ma'am is visible to us, but Vijay Lakshmi ma'am is always behind the scene. She's working hard and she's available 24 by 7 throughout this course. So a special thanks to Vijay Lakshmi ma'am. Thank you for all the encouragement and support whenever we needed. Thank you, ma'am. So we move further. I want to stop by and uh, give a brief about what Sudisha Counseling Center does. So, Sudisha Counseling Center, which is headed by Dr. Geetha Challa, it is in Kondapur. So, we provide services like IQ assessment, personality assessment, and all assessments we do. And we help with all kind of therapies. So, if you're looking for any of them, so you can definitely reach out and a briefing on the programs that are done at Sudisha Counseling Center. So these are the programs run at Sudisha. So we have a positive parenting course also if you are interested to get into. And we have life skills program and programs for child safety, especially for girls, and ideal behavior toolkit for boys. And there are so many programs. You can actually take a screenshot of it and reach out uh, if you want to. I just want to talk about the next session coming up, which is on Monday. Stay tuned, same time, 5:30 to 6:30 Monday. It is a session on all kind of phobias. We will get insights on all sort of phobias. It is being conducted by Ramchandra Reddy sir and Vijeta ma'am. So it is going to be interesting session. I would request you all to join us on Monday again. Um, Thank you so much for this opportunity, for this platform, and for joining us today, this evening. Nitya, would you like to add something?
Yeah, thank you everybody for joining us. And every child who believes in themselves has a parent who believed in them first. And thank you all for joining us. And once again, thank you.
Thank you and have